Hey there, Dr. Scott McLean in my first N1 surgical experience. We're going to take you through this, so we'll go through the implant itself, doing a pre-surgery review, and then also the kit. So we'll have a look at the kit, and then we'll get into a surgery, and we'll show you how my first surgery went. When we're looking at this, my first thoughts were this kit is really small, which I like, because we want to have things be a little tighter and easier to use. So let me show you a few different things about the kit. If you look over here, this is the Osseo Director, which is the first drill that we use when we're doing an N1, and that's usually at about 2,000 RPM, although I'm a little bit lower on the RPMs. We're going to use a direction indicator as well, and after the direction indicator we go in and do the Osseo shaper and then go into the driver. So you can see the kit has everything you need, and we'll use the step here, and this is going to tell you how long each of the drills are, so you can double check. So measure twice, cut once, that concept. There's a new torque wrench as well with the torque wrench internals, and the torque wrench itself lays in this area and it's very easy to pick up. So if we take the internals, it's easier to clean when it's apart like this, so there's a location for that, and then you'll screw this down, and this will enable you to have the torque wrench sterile on both internal and outside and make it super clean. And you'll notice that we have a surgical driver holder, and so this is going to fit into the end of the torque wrench. And so when you pull on this torque wrench, you would never put your thumb underneath this area, but you're going to initiate the torque, and you see the flat handle underneath the finger, and you can see the thumb is just holding this to show you the different torques. But it's a nice way to kind of really hold this area and get your torque to be accurate. You'll also see that the drivers that are used are very specific, and they have a little gold part here on this driver for the 4.0. And this area shows, I call this the bumblebee, and so you want to be on the top part of this black at the tissue level. So here is showing 11 millimeter, which we're not using, but you can see when we go through this, we're going to use this as our kind of full seating depth. So we're looking at tissue and also bone level here. So as we go in, we're going to go to the bone level right there, and then the soft tissue is at the top of this bumblebee effect that I'm calling it, and it's the top of that black line. So let's have a look at my first surgery, and you can see here that there's the N1 in its packaging system, and we would take this N1 out of this packaging system once we're ready. So let's remove the tooth. We're going to do an immediate placement, and we'll place the implant right away. So we'll use the physics forceps, and we just loosen that so it's more of an elevator than a forceps. And take that tooth out. We'll clean it out with a spoon, making sure it's all nice and tidy. And then we'll go back in and do a placement. So you can see how small these kits are. They're fitting, both of these kits fit inside of the top of the other my surgical kit, and you'll see when we're going through that we're able to then have the prosthetic kit about the same size as the surgical kit, so it also has all this outline so that we know which drill to use when. So we're going to use the Osseo Director first at less than 2,000 RPM with water, then we'll go into the Osseo Shaper 1. So let's have a go at this. So the Osseo Director drill, I'll just pre-measure this to make sure I know which line is which, because this is always something that's important to me, to know which line I'm going to be drilling to. And also you can see that we're going to be going on a higher RPM, so I'll position the drill. And you can position this with a 2 millimeter guided type of template, or we can just go in and use the 2 root system, and you can see I had to use an extension. And the extension is nice because it actually helps to parallel everything in between the 2 roots, and you can see we're going up inside and positioning this implant exactly where we want it to be. So you can use a direction indicator at this point, and I'm just using a drill to look at it and make sure that I'm on target. So then we're going to go back in and start to use the Osteo Shaper, which will be used at 50 RPM, less than 40 Newton centimeters. And this will allow us to shape the area. So the Osteo Shaper 1 is going to be with the implant, as we were talking about. This packaging is fantastic. It has the implant plus the Osteo Shaper 1. So we'll snap that into the latch, and it will use some lateral pressure on these two wings, on the white wings, and this makes it snap apart. And you can see that the sterile drill is now inside and loaded fully to use it in the patient's mouth. So we'll go to the patient and we'll use this Osteo Shaper 1. We'll measure it first just to verify that it's 13. You can see here that we put the tip on, and this will allow you to see that you have the right instrument to match the implant. But they're both coming together. Now when you go to full depth, the goal is to get that so that you're going to be also paying attention to soft tissue. And we want to be usually about 3 millimeters below soft tissue zenith, which is the high point on the crown. As we go in, we're going to position this so that we start to go very slow drilling without any water. So the patient's not feeling very much vibration, and he had an implant before, so he said that this felt a lot better when he had this implant, which is interesting. So to be clear, you use water on the first drill, which is the Osteo Director, then you do not use it on the Osteo Shaper, which is in the middle, and you do not use it on the implant because the implant is very hydrophilic. Now you have to reverse the Osteo Shaper out. And what you'll see is that the slurry of bone is going to be on this drill, which is interesting because this slurry stays in the osteotomy as well, and this is thought to improve the healing. The top two images show cell death at day 0 and then at day 7, and how the old drill systems used to work, where the lower two images show the newer system of this slurry of bone that's coming in, and you can see in particular on the lower right that this slurry of bone is thought to heal a lot faster, and so this is going to be around the implant when you're using the N1 system. If we go back to the original case, you're also going to have the implant in this case with the Osteo Shaper. So as we reverse this upside down and hold it against the desk, you can kind of push this implant down and get to it. So let's just pull this up and you'll see the implant underneath. And there it is, the tri-oval conical connection, and it's all ready to be used. And so it's a great packaging system, very well thought out. Now when you place the implant, you'll take it out of the package. You see it's going to be picked up by the driver. So you go in when it rotates, and you'll see this little gap around the outside of it. And don't be too concerned about that. You'll take it and you'll start to put the implant in. You're going to go to bone level. When you go to bone level, the second black line on top of that bumblebee effect is going to be at the gingival zenith. And so here we go. We can see there's that second black line. So there's yellow, black, and it's that second black line that you want to have at the gingival zenith as long as you have bone level at that level. So you have to check this out and do your x-rays and make sure you're okay. So as we take this, we can see the anodized surface of the implant in gray and also gold. And this is made through an electrolyte process, but they're putting it through this both time and also electricity, and they're causing the surface to be rough. So it has variable roughness as you go up and down the implant, and this is very hydrophilic as well. And so there's a special surface coating on top of this implant that keeps that hydrophilic nature. So as this goes in, the blood's going to be very attracted to the implant, and it has various roughness as you go up the implant, so that when you're in spongy bone versus cortical bone, the implant's going to have a different type of effect on the bone itself. So in summary, this anodized roughened surface is going to help with osseointegration, and then the Zeal abutment, which is going to go into this implant, helps in mucointegration. And so the goal is to have this roughness at the right location to help the body to heal and to have all the cellular functions that happen to make it successful. So here I'm going to check the depth of the implant. You can see those black lines that I'm talking about with the bumblebee effect. You can see I need to put this in a little bit deeper, and I can tell by that top black line. So you need to really look at these drivers and to become very familiar with them to enable you to know the depth. Then angulation is always the same as what it's generally been. So here I'm going to check the torque. You can see I'm getting about 20 Newton centimeters. So I'll put a surgical cover screw on and come back after this is healed and start to do the Zeal abutment. So this is a fantastic experience for me. And I'd like to thank my team, both Julia and Halima at the chair side, and also my front team and Calicia for organizing this event for the patient. So this is Dr. Scott McLean. This is a YouTube and also an Instagram video about the N1 dental implant having the tri-oval conical connection.